Before COVID-19, on a daily basis, over 400 children and youths would come to our Educational Resource Center to access programs focused on quality education through academic tutoring, leadership development, HIV/AIDS health awarenesses, nutrition and food security, and many others. Our model is based on creating opportunities for these youths to build resilience, reach their full potential, and break out of their impoverished situation to become the leaders that their communities need to end poverty. With the COVID pandemic came the closure of schools in the area and our center as well. As cases and deaths began to rise in Kafue, we knew we needed to reach out to our children and their families. After an initial round of phone calls to nearly 200 families, 58% reported that people in Zambia do not believe that COVID-19 is real. We understood that the most effective way to reach our children and families to ensure they had the information they needed to keep safe would be through weekly health check-in calls. Each week's phone calls would be adjusted based on the previous week's finding, as well as the myths and misconceptions we knew were circulated. The topics included the symptoms of COVID-19, how to properly disinfect a face mask, how to effectively wash hands and sanitize, and when to go to the hospital when somebody at home is feeling unwell. During these calls, we would also discuss issues like the increased gender-based violence and also the mental health which were affecting our families. This system works. 91% of families find these calls extremely or very helpful and informative, while the rest find them informative and helpful. Results from these calls have shown that on average, 98% of families were washing hands regularly, 94% were wearing a mask, 77% were avoiding close contact with others. When the calls focused on symptoms, mask, and sanitization, the data showed a 20% increase in families having an increased knowledge of COVID-19 symptoms and a 30% increase in showing how to disinfect a mask. The calls also allowed our team to accurately track deaths and sick family members, and also to cancel those with COVID-19 symptoms.
It also provided us information about the coronavirus pandemic and how we can safeguard ourselves through this pandemic. I felt safe because of Amos.